that doesn't mean you transform instantly, right? That means that
it's dangerous to transform instantly. We're doing it bit by bit, baby steps, which are sustainable. So, Dr. Baker, and I think we've talked about this. He alluded to our HITE ED, our ED innovation, where Dr. Nathan, I can't wait till he sees this movie tonight, so supports his approach. We will be doing acupuncture with patients in our drop-in group medical visits. We will be doing meditation. We will be offering things that aren't just pharmaceutical, that really are helping people develop the skills to manage their lives. Do you want to go ahead and talk a little bit about your...
Yeah, so Kate, would you like to make a comment?
I just wanted to ask Dr. Baker. Dr. Baker's took us years to get to the point where we have, it's taken us years to get to this point of, pharmaceuticals, specialists, and when you think about it, it's so 180 from where we need to be. We are like encouraging bad behavior. Now, what I would like to know is, do you think it will take us as long to swing back around to, reimbursing people who do preventive care, not the specialists, but the primary care physician, where the grassroots really needs to be? Do you think it's going to take us that long to swing back around?
We will swing back around very, very quickly, and the reason we will do it is that we are breaking. And so we absolutely, and it will be very painful, and it will be very hurtful, but oh my goodness, change is going to take place, and it's going to take place far more. We got ourselves into hot water gradually over a long period of time. But, when the water gets hot enough, you flat out get out of that, So it will be much quicker, and it will be very, very painful. Yeah.
I know that there's another showing this afternoon, but is it being shown anymore in Charlotte?
It's going to be shown 3 times today, and I don't know of another showing.
So this is kind of where this is going. At the end of February, this movie will actually come out on DVD. So unfortunately, prior to this, you had to go somewhere to see it, and as you heard me say, Kathleen and I started looking, we couldn't find it anywhere close, and that's why we've done this today. Unfortunately, it's a handful of people, relatively, who are going to see it. We will show it again at 2 o'clock today. You're welcome to go out and get on your cell phone and call somebody you think needs to be here and tell them to be here, because it's not going to be full. This evening, we actually have, all of our providers, we have 200 medical homes who we work with, 200 plus. They've all been invited to come tonight. A number of them are coming. Not as many probably as we're going to hope, because we really are trying to transform at the primary care level. And thought leaders will be here as well tonight, people who are in decision-making capacities. We'll see who shows up, but we're not going to shut up. We're just going to keep talking about this. We want to be part of the solution.
And we're not just going to be talking. Right?
Right.
I mean, it really is. I mean, the people in this room can do this. I mean, we can do it. We do it on a small scale just because we're just the people in this room. But we can do these things. And there are people out there that are willing to provide the resources necessary for us to do things. So, how many of you in this room have had your motivational interviewing training? Right? Somebody did that. We provided that. It was available. You took advantage of it, and you're using it. Right? That's change right there. Right? The whole process of getting the patient involved in their care, motivating them, and making them active instead of passive. In every sense of the word.
What kind of think tank or opportunities are there for people in the field, front lines, practitioners on all levels, to feed back to, you know, the groups of people that are on the different levels who are coming together, deciding these are the grants that we need, these are the pilot programs we need. How can we foster that conversation from the front lines to those levels?
We're fortunate because we are part of an organization, I mean, Community Care of North Carolina, and Dr. Dobson, who is our CEO, is going to be moderating a panel tonight who is doing exactly that. So by virtue of being part of our organization, you all are part of that, and we want your input.
Yeah. Well, you know, there's this idea in child rearing that the key to being a good father or being a good mother, the first thing is show up. You know, just show up. And that's what you guys got to do. I mean, if you want to evoke change and you want to be part of the dialogue, you've got to show up. You've got to say, okay, I'm going to go to that meeting. I'm going to send an email with suggestions. You know, you just have to do it. There are plenty of forums. Yes, ma'am.
And reflecting off just what you said, children learn what they live, and we could integrate patients learn what they live. And if we set the example for them, you know, primary doctor, eating right, you know, try something alternative besides taking this medication. If we teach them to learn what they live and live it before them and educate them about it, hopefully they will take a swing back in the other direction. Because their mindset is so much of, you know, I'll take 22 medications and I'll eat what I want and I'll still continue to smoke. We've got to learn and educate them to live before them.
If I can just go back for a minute to Nanette. Nanette, I'm going to just say, you've done this. You're going to practices. You've taught the CHEK class. You've been very engaged. I mean, you're already doing it.
Well, thanks to Allison and to the program that, you know, pulled up this program. But that's just it. I think I would not have had that opportunity had that vehicle not been in place to even consider someone in the position that I'm in that is not necessarily traditionally medicine, you know. I happen to have, you know, a background in recreational therapy, so I already had a predisposed opportunity to understand the importance of this.
And you stepped up to the plate.
Right, but I think there's a lot of us in different positions, whether it be on the phone, whether it be in medicine, whether it be nursing, social work, whatever, that we do touch people. And so it would be nice to know that how do we take our ideas and share that and bring that to the table, you know, and to see that there would be that going back and forth in the conversation because, you know, as I've often experienced, for instance, on a university setting, you know, it's the professors who teach the students, but when they want to put their students out there into the field, it's the practitioners who really can make that perfect marriage so that on the academic level, there really is an understanding of what's going on out there. So, you know, I think we have a great opportunity. I'm like really stoked about it, but yeah.
But the other thing you've seen us do a lot of is, I think everybody is aware and everybody's doing it, is if there's a partner that we identify, we're going to that partner. We're bringing them to the table. And, you know, we were talking about being at War Place yesterday. You know, just whoever we need to connect up with, strengthening our behavioral health relationships, you know, health check coordinators going into the practices and doing some active work. So I think we're starting to really, I think you're right, we're on the front end of that.
I think as a system, in order for us to be able to really make a change is to fund the services that will be, in order for us to really make a change, the services will follow the funding. If you reduce funding for the more extreme services, more invasive services, and instead fund the more holistic services, then there will be increased utilization and hopefully increased health.
Yeah, there's no question that the movie is right in that money is the driver. I mean, it's the big driver. And altruism isn't necessarily the big driver. It helps a lot. But money is it. And that's going to be the painful side of stuff. Because the money is going to decrease. The amount of just plain old coin that we have to spend on healthcare is going to go down. And the programs that get that money are going to change. And therefore, parts of the industry of healthcare that cater to salvage medicine, which is sort of what we call, once you're sick as a dog, we sure can fix you up. If you're insured, of course. But by crackety, we can fix you up, but we want you to get as sick as a dog because we make more money if you're sick as a dog and we bring you back. Well, that will end. But boy, is that going to hurt, right? I mean, it's going to be a painful thing, big time. But that's what has to change. You're exactly right.
I overheard a conversation with some physicians. Physicians don't like to talk about money.
I do.
I was saying I overheard a conversation with some physicians, and they don't really like to talk about their salary. They talk about money. They don't want to talk about salary and bonuses. But they were talking about, even within CHS, how it's painful. They noticed that their bonus potential or pay raise potential, just like we felt for a while, but for them, it's really starting to be painful. So, it hurts, and it's sorry to say, but it's a good thing to see that they are trying to make some changes within our system.
I just have a quick question. I've been in nursing a long time, done all kinds of nursing, I've seen a lot of changes, and have been fortunate enough to be in a position to move and be flexible and learn the new. But I'm a little concerned in our case management now. Yes, we can look at resources, we can try to educate. These are things we've been doing on a regular basis. But how do we really educate people out there? I think that's the biggest problem I have, is trying to get others to buy into what I'm trying to do to make the patient better.
Educate others, meaning our partners or the patient themselves?
The world. We're making contacts with all kinds of people, not only just patients. We go to seminars, we meet other people, there's a lot of networking going on and whatever. But I have yet to find that there's a real good way to reach these people so that they will come around and understand what the new dynamics are.
Susan, I've been in healthcare probably almost as long as you. We've talked about this.
Yeah, I'm sure you have.
And I can't tell you how excited I was when, we were writing an evidence-based guideline looking for what's the best way to work with patients with chronic illness. You all, I know everybody's sick of hearing me say that, but when I found motivational interviewing, did some training with William Miller, and saw the evidence. I don't know how many people have embraced this and to what degree you've embraced it. It did a couple things for me. It made me try to stop rescuing people. It decreased my burnout. It made me more effective because I was having more effective conversations because I wasn't trying to fix it for somebody else. I was eliciting from them what they were already ready to do. And it is baby steps. It really is dangerous to have somebody change overnight because it doesn't take quite like that. It takes processing and internal work and those kinds of things. And anybody who picks up the phone and calls patients on a regular basis knows that. It takes a period of time. It takes a lot of conversations. But they're critical conversations.